To tell us more about how natural disasters can impact the mental health of those affected is Dr. Caroline McDonald-Harker herself, professor in the Sociology department at Mount Royal University. Dr. McDonald-Harker, welcome to Forum Daily.
Thank you. Pleasure to be here.
Now, what do we know so far about how disasters may impact people in the long run?
What we know and what my research findings have shown is that major disasters have not only devastating impacts on physical infrastructure like homes, buildings, and wider communities, but they also have long-term mental health impacts on individuals who are both directly and indirectly impacted by disasters. And in fact, the mental health effects following disaster are so profound that they last much longer than the visible destruction caused by disaster, with some people still suffering effects even 10 years later.
Now, that's very interesting, Doctor. So we mentioned you studied the impacts of flooding and wildfires in Alberta. What did you find?
Certainly. What I found from my research is that it can take several years before people who experience a disaster even notice the mental toll it has taken on them. Oftentimes, people don't deal with some of the mental health challenges that they are experiencing. They keep putting it off, thinking that if they focus on rebuilding and getting their home back in order, then the mental health challenges will go away. But often they don't. And unfortunately, at that point, their mental health challenges have become exacerbated. And so my research has also found that strong communication, support systems, and a positive outlook were better able to help individuals cope and move forward after experiencing a disaster.
So taking all of this into consideration, how do you think the BC flooding is likely to impact the mental health of people in the region?
Based on my research on the 2013 Alberta flood and the 2016 Fort McMurray wildfire, it's highly likely that individuals will experience either short-term or long-term mental health challenges. Disasters are stressful. They are traumatic experiences, and there are specific populations that are more vulnerable to the effects of disasters, including women, children and youth, immigrant populations. And so it's crucial that mental health supports, resources, services, and other supports are accessible to individuals, not only during disasters, but also in the post-disaster context.
All right, doctor. So how can someone identify if they or a loved one has been mentally affected by a disaster?
It's really important to notice if one's behavior has changed. So, are people sleeping more or less? Are they eating more or less? Are they more irritable? Are they utilizing substances as a way to cope? So certainly important to pay attention to how you're reacting. And of course, experiencing stress is very normal in the immediate aftermath of a disaster. But if it ends up being prolonged, then that's when individuals really need to pay attention and reach out for some of those formalized supports. And I know that that's easier said than done. A lot of people are reluctant to access formalized supports. And so my recommendation is always that they reach out to their own immediate network, that they are open and honest with people in their environment, and they talk with them about the challenges that they are facing.
And we know BC is now implementing recovery efforts following this flooding. So is there anything that government officials can do to tackle this issue?
Absolutely. It's essential that governments, whether that be at the federal, provincial, or municipal level, become better prepared for disasters. We know that disasters are occurring at increased frequency, and they're likely to continue to occur. Therefore, it is crucial that government bodies engage in disaster mitigation efforts, that they develop disaster relief programs, and that they help residents better understand disaster risk and preparedness so that individuals are better prepared the next time they face a disaster.
30 seconds left here, Doctor, but what are you keeping your eyes out for as BC is recovering from all of this?
Absolutely. Certainly, there is a lot of emphasis on the physical rebuilding. However, it's important that mental health supports are provided to individuals at the same time concurrently, as opposed to waiting months or years later, because individuals do need those immediate supports.
All right, Dr. McDonald-Harker, thank you so much for joining us today on Forum Daily.
Thank you for having me.